Hi, everyone, and welcome to another episode of MMT Mondays. Earlier this month marked the 40th anniversary of the CDC reporting the first official cases of AIDS in the United States. Since then, it has taken the lives of over 32 million people, with 700,000 of those being in the United States alone. Although media coverage has waned within the last decade, HIV and AIDS are still significant public health issues that require significant funding. As a sovereign currency issuing nation, we know that the United States does not have any monetary constraints to fully fund the research into developing a cure for HIV and AIDS. As we have seen during the pandemic in this last year, when money isn't an issue, rapid progress takes place when it comes to finding vaccines. Federal funding for HIV has increased significantly over the course of the epidemic, rising from just a few $100,000 in 1982 to more than $34.8 billion in 2019. How well we track HIV and AIDS determines the amount of money that states receive in federal funding. The amount each state receives in funding then is determined by the Ryan White CARE Act. The amount each state receives is calculated based on the number of cases reported to the federal tracking program. Tonight, we're going to track the progression of the HIV/AIDS epidemic and how once we view our economy through the lens of MMT, we will see that we can afford the spending necessary to not let finding a cure for this virus that affects so many in the LGBTQ and other minority communities fall to the wayside. In our first example, we will see how the early years of the AIDS epidemic were an uncertain and unsettling time. LGBTQ communities were losing friends and loved ones to the disease one after another with little idea as to how or why. All the while, it seemed society had turned a blind eye. President Ronald Reagan's administration paid little attention to the epidemic, with 4 years going by before Reagan made a public mention of AIDS. Exchanges between Reagan's press secretary and reporters in 1982 and 83 indicate that the nation's top officials in mainstream society viewed the disease as a joke and not an issue of great concern. That stemmed from the perception of AIDS as a gay plague, a condition thought to be tied to the lifestyles and behaviors of gay men, even though cases had already been reported in women, infants, and those with hemophilia, and even people who then injected drugs. We will see that while the Reagan administration was preaching abstinence, because we all know that telling people not to have sex totally makes them not want to have sex. But anyway, while Captain Conservative was browbeating those pesky communists, the human toll of friends and loved ones succumbing to the virus continued to grow.
Scientists at the National Centers for Disease Control in Atlanta today released the results of a study which shows that the lifestyle of some male homosexuals has triggered an epidemic of a rare form of cancer.
Living in New York in the heart of the beginning of the AIDS epidemic as it kept mounting was a horrifying sci-fi movie.
Somebody lose weight or somebody has a pimple, and everybody was always like, oh, she has it.
We want to identify every person who's a carrier. We want to identify every possible way to stop them from spreading the disease.
Klaus Norm is the first person that I knew that was dying of AIDS. Going to visit him, it was crazy.
The Klaus was at the hospital. It was like they had found an alien from Area 51, all in plastic and covered up. They put me in a jumpsuit and a mask and a helmet and gloves. They said, we don't know what this is. And I walked in, took the gloves off, the jumpsuit, and I got him, hugged him, held him, kissed him, and I could see the doctors banging on the window.
If the only way to stop it is quarantine people, I don't think there's any way around it. I think they're going to have to do it.
These people, they're not fit, they're not human beings, they have emotional problems.
Do they see them on the street, RuPaul?
You're the disgrace to the human race, you know that?
Every day you heard about somebody else who had died. Everybody was torn between grief and terror and absolute rage at the government because President Reagan did not mention the word for years.
Mr. Reagan said prevention is better than a cure.
Abstinence has been lacking in much of the education.
Within my own community, ballroom community, I started seeing how everybody was pushing away Like, don't touch me, like they wouldn't eat from the same spoon. They wouldn't do anything. They don't want to breathe next to one another.
You didn't even know what to make of it. It was a creative holocaust on everyone that one knew.
Gary and Julio, who lived here with me, they both died of AIDS, and
the names just kept pouring and pouring, and I just was waiting for them to say my name. When I was personally diagnosed, I accepted it right there on the spot. The doctor only confirmed what I already knew, because I felt I'm gay. I have AIDS. Without even knowing, I just felt like, being gay is AIDS. Street kids, at one point, were bonded. But I wasn't getting help from anybody to say, it's okay, we love you, because they were going through the same thing.
But as you see, the AIDS epidemic resulted from a catastrophic failure at all levels, especially from the federal government. The Reagan administration refused to even acknowledge what was going on due to the desire to tighten the belt on taxpayer dollars domestically. Now keep in mind at the same time that they couldn't care less about the debt when it came to the military budget, because, we were fighting the evil empire of communism. You will see time and time again the scientific community reaching out to the Reagan administration, pleading for funding, only to be ignored or dismissed with the response of President Reagan himself saying, "Why? Aren't all the right people dying?" But overall, we see yet another example of how austerity politics results in the deaths of the most vulnerable communities.
The fact is, AIDS was allowed to happen in this country because our institutions did not respond. And that includes the gay community, the scientific establishment. It also includes, I think, and a star billing, the federal government. Clearly, it was a very bad time to have a new epidemic to appear in June of 1981, which was just 5 months into the first term of the Reagan administration. This was an administration that was committed to doing one thing beyond all else, and that's to keep a lid on domestic spending. So throughout the early years of the epidemic, as scientists and public health officials became increasingly concerned and wrote increasingly dire predictions in their memos to the Reagan administration saying, we need money, we've got to move on this, we've got a disaster ahead, they were consistently ignored by an administration that did not want to spend any money on domestic programs, much less on domestic programs that were going to fight a disease that was essentially just killing off gay men and intravenous drug users.
As politicians and government entities proved slow to react, it was the activists on the streets who took matters into their own hands, doing what they could to combat homophobia and stigma and make sure that their communities received the public health information they needed. In the early 80s, HIV and AIDS was considered a death sentence. Scientists and physicians were struggling to understand what caused the disease and how it spread, making the process of finding a treatment all the more challenging. Similar to many issues today, social stigma played a crucial role in stymieing and preventing a government response. The same reason why those in power refused to pass Medicare for All is the reason why President Reagan refused to even utter the words AIDS for over 4 years. They refused to take the virus seriously because of the community that was getting sick. The stigma around homosexuals and people battling drug addiction gave the government little incentive to combat this epidemic. They view the working class and other marginalized communities as expendable and would rather gaslight people with the excuse of we can't afford it. As you see in this next example, it was the activists in the streets like Larry Kramer and the founder of ACT UP, Eric Sawyer, who forced the government to take the AIDS epidemic seriously through their acts of civil disobedience. The actions of Sawyer and millions more forced the government to fund research into combating the AIDS crisis, and by the 1990s we saw tremendous breakthroughs in helping to combat this epidemic.
The early days of the AIDS response were really characterized by fear, terror, stigma, discrimination, misinformation, and by a lack of information. One of the problems why society and the government didn't care was the people who were getting sick. It became known as the disease of junkies, queers, and whores. And those are people on the bottom rung of the totem pole of society. And even Ronald Reagan, when he was asked in a cabinet meeting, shouldn't we do something about all these people dying of AIDS, responded with a laugh saying, why? Aren't all the right people dying? Around the mid-'80s, there became a movement to have visibility for AIDS, and ACT UP was founded in '87. That basically took that a step farther and said, we are going to turn our anger and our grief, our anger over society's lack of response and our grief over the death of many of our loved ones, and turn that grief and anger into action.
Eric, just for our listeners to know, how many times have you been arrested for civil disobedience?
I've literally been arrested doing civil disobedience protests more than 100 times.
So why do you think it's so important for younger generations, especially within the LGBTQ community, to understand what happened during the AIDS epidemic? And do you think that they do generally?
I really don't think that younger generations, especially of, gay men, know what it was like for those of us living with AIDS in the early days of the epidemic. Now with the advent of PrEP, people don't really worry about getting it because they're like, I take a pill in the morning, so I'm not going to get it. And they don't realize the discrimination, where we were literally not admitted into hospitals, or doctors wouldn't treat us, or funeral homes wouldn't embalm our bodies. And young gay men don't know that, and they don't know how stigmatized we were. Young gay men of color and young trans people, because they experience a level of discrimination and prejudice and mistreatment simply because they're people of color or because they're trans. And I think it's more in their wheelhouse, and they're more aware than kind of privileged middle and upper class gay men. And I think it's unfortunate that all gay and lesbian people don't know that history, because I think it makes you really aware of societal injustice, of social injustice, of economic injustice, of, the injustices of the legal system. And I think that, everyone has a responsibility to try to improve the position of every other person living in this planet.
Thank you so much for watching.
And if you want to learn more queer and teen history, check out the rest of our videos, subscribe so you'll always know when new ones are coming, and until then, follow us at Everyone's Gay on Instagram.
As you can see, we can't wait for those in power to find it in their hearts to give a crap about the needs of the working class and marginalized communities. It is only through direct action by activists in the streets that are willing to put their bodies on the line that we are able to force those in power to hear our voices. We see that funding started to pour in from the federal government once people not only stood in solidarity, but also educated themselves and others. That is what we must continue to do today. Once we educate ourselves about how our financial system actually works through the lens of MMT, then we can build coalitions of people to demand the government take action to alleviate the suffering of so many people who have been ignored and forced to suffer in silence for far too long. We can build coalitions of people that go beyond Republican and Democrat, because we know that both of those are just two sides of the same corrupt coin. We, the working class, can demand policies like Medicare for all and a federal job guarantee that will provide health care and a well-paying job so that members of the LGBTQ community no longer have to suffer or fear retribution for being simply who they are. If you enjoyed tonight's video, make sure to check us out at realprogressives.org and subscribe to get notifications on new video streams in YouTube, Periscope, Facebook, and Rockfin. Thank y'all, and have a great week.